As an invasive surgeon, everything has an incision, everything has blood loss, there are healing processes. With HIFU, there's very little of that. In fact, there is no incision except for the suprapubic catheter, and it's a very, very concise way of performing surgery. It's usually a surgery center type of outpatient procedure. It takes a couple hours, and men are back to their usual and customary work at a very short interval. Usually a week, they're back to work. Sexual function and incontinence are two of the issues that urologists are asked about. What is my treatment going to leave me? And HIFU has the ability to spare nerves and spare the sphincter for incontinence. And most men who undergo HIFU are not incontinent and they're not impotent. So HIFU does give men another choice. It gives them a choice of treatment at any stage, and especially in the early stages. So there's a term that everybody uses out there. It's called active surveillance. It's prostate cancer that is small, but for sure they're diagnosed by biopsy. And a lot of men are electing not to have any treatment at all because the cancer is localized and it's small, and it probably will not go so far as causing something changing in their livelihood. But HIFU allows men who are going to go with active surveillance to have something done. They actually can have some treatment instead of watchful waiting. Patients show up at the surgery center and they undergo either a general or a spinal anesthetic. Usually it's general anesthesia because you want them to stay completely still while the HIFU is going on. HIFU takes a couple hours. They leave the surgery center with a catheter. The catheter is left in for a couple days to a couple weeks, depending on how much energy is delivered. Other than that, check the PSA blood test before and after the HIFU procedure, and that's really about it.